Welcome back to the Kolender Medical Show. I'm your host, Anne-Marie Cronin, here with Dr. Brian Kolender, MD, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms in downtown Detroit. Dr. Kolender is here with us discussing his concierge practice and how to avoid heart attack, stroke, and how to begin the reversal of artery disease. Now, Dr. Kolender, welcome to the show again, and tell us, how did you get into this specialty of prevention?
Well, Anne-Marie, thanks again for having me back, and I'm really excited to have this show. I'm excited to have an opportunity to help everyone learn to prevent having a heart attack and stroke. And how I got here is a few years ago, actually. I recognized I was not going to be able to take care of my patients the way I wanted to in a traditional system. So I transitioned my practice from a traditional practice where I saw 30 people a day and I spent 7 minutes with a person to a practice where I have much fewer patients, but I'm able to spend more time with them. And that time gives me the opportunity to work more on everyone's individual health. I actually joined a group called MDVIP that gives me the infrastructure to do that kind of care and also helps give me the information and guidance to treat people the best way I can. And while I've been practicing in the concierge model, I've had some experiences. I've learned to look outside more of traditional medicine, not just in terms of how much time I get to spend with patients, but I had some opportunity to do what I would call functional medicine lectures, hearing from doctors who kind of operate a little outside traditional care.
Hold on a second, I want to ask you, what does that mean, functional medicine? What does that mean?
Well, it can mean a lot of things, and it might be interchangeable with holistic, or I use the word functional, which is maybe more of a blend of traditional and holistic. I'm trying to stride both sides of taking what I like out of traditional medicine, and then also using what I like out of holistic medicine to apply what I need to apply to my patients, again, on a personal basis. We need to know each of my patients on a one-on-one and figure out what's best for them. And that's really the key to preventing heart attack and stroke. And what I learned in this process of kind of looking to mentors outside of traditional medicine is you don't need to think that you're on a track. There's some dementia in my family, there's Alzheimer's in my family, and I used to think that when I hit 75, I better do whatever it is I was gonna do and put me
avoid it, right?
Well, by then I was done.
Right.
And put me in a field.
Right.
So I thought that's what was gonna happen. And what I learned is that that is not cut in stone, and that I personally have an opportunity to change my future and be a better, live healthier and not be able to avoid Alzheimer's. So I changed my life after hearing this lecture. I will say this lecturer was talking to other practicing physicians, and he basically said, if you're not doing what you tell your patients to do, you're a crappy doctor. And I heard that and said, he didn't say crappy, but I heard that and I said, you know what, you're right. And I'm gonna start walking the walk. And since then, I've lost 30 pounds. I'd say I feel fantastic. I couldn't feel better, and I feel like I'm on the path to avoiding dementia as I get older, and I do not feel that I'm trapped in this path at all.
Okay,
So,
let me back up a little bit here. So you have a specialty you're an internal medicine doctor with a specialty in artery disease. How long have you been practicing internal medicine?
I've been practicing internal medicine since 1995.
And then when did you switch over? How long have you been doing this concierge practice where instead of seeing a patient for 5, 6, 7 minutes, now you're spending how much time?
Well, I transitioned to my concierge practice at the end of 2014. So December 2014, I opened my MDVIP concierge practice. And then over the course of time, I've learned more and more about what I need to do, because being I don't like the word concierge again because it sounds fancy, and I'm not a fancy person, and I'm going to say none of my patients are fancy, but being a personalized healthcare doctor allows me the ability to identify what each of my patients needs, and allows me time to learn what I need to do and do some things outside of what's allowed by the system, which is the reason why we need this show, is because the system is broken and we're all getting sick. And one of the things I want to let everyone know, and we're going to talk about next segment, is heart attack is still the #1 cause of death in this country and has been for 100 years, and nothing's changed. And if you hear that, you ought to be pretty mad. And the fact that you don't know, every day in the news you hear a contradicting piece of information. True. Take aspirin, don't take aspirin, eggs are good, eggs are bad. Well, that's nonsense. And what I want this show to be is a voice of reason for you to get information from me on what's the truth. Because all the news out there is being spun in some direction, and I'm going to give you the straight scoop with a goal of making sure everyone out there can avoid dying from a heart attack or being disabled from a stroke.
Well, also now, your patients now have more time to spend with you, so instead of just seeing them, when they come in because they're sick, you've got a lot of time to spend with them.
Well, that's the key. That's right. What we need to do.